Hello and welcome to Breathe India. So today I'm very happy to welcome Dr. Tanmay Kulkarni on the show. So why don't you tell them what a structural or interventional cardiologist is exactly?
So cardiology is basically a doctor who is well trained under a subspecialty of medicine, that is a cardiology. I have learned the holistic approach to a patient. So how can I be more like a mentor rather than just a doctor?
What are the major lifestyle changes you'd like to tell your patients or your to-be patients? Hopefully they're not your patients, they are healthy. Or you go to a office, or you give a talk somewhere. What is like the main three things you're going to tell them?
Okay, so that's it's a very important question you have asked. This is very important for everyone. So from age 15 onwards till elderly, it is applicable to it. What exactly is happening in nowadays is people are stressed a lot because of so much of maybe competition. 10th grade person, a boy or a girl wants to get into maybe IIT or maybe something else, or medicine. So they're competing a lot. They're taking the stress.
Hello and welcome to Breathe India. I'm Rita Date, your host. I'm a yoga and meditation coach and nutritionist, and I've written 2 books on eating healthy the Indian way. So on Breathe India, on this show, we talk about M&M, not the candy, but mind, nutrition, and movement. All elements you need to live a healthy life. If you want to cut through all the wellness clutter and get practical information, all backed by science, you come to the right place. So today, I'm very happy to welcome Dr. Tanmay Kulkarni on the show. He is a structural and interventional cardiologist, and he will explain what that means. But I'll give you a little background on how this happened. About 6 weeks ago, I had an angioplasty, and everybody was shocked. I do yoga, I do meditation, I know what to eat. How did this happen? I mean, I have calls from everybody in my building, from all my friends saying, they're just surprised that this happened. But heart health is something that I have learned. I had high cholesterol, which runs in my family. I didn't address it, but there are many other factors that I won't get into. Long story short, I was very lucky. I did go to a cardiologist. I did the tests, found what was needed to be done, and got the stent that I needed. And I'm here today, back to work. I feel that I'm very lucky, and I thank God every day. Because in the last about 4 months, I personally know 4 people who have succumbed to heart failure. So, it is something that we need to address, and we have one of the best doctors in Pune, which he practices here in Jupiter Hospital. And hi, Tanmay. Can I call you Tanmay? Tanmay is good?
Yeah.
Okay. So why don't you tell them what a structural or interventional cardiologist is exactly?
So cardiology is basically a doctor who is well trained under a subspecialty of medicine, that is a cardiology. So cardiology has one more subspecialty, that is interventional cardiology. So cardiology as a whole has one part, that is interventional cardiology. Basically, you can say it's a newer surgical thing, but without opening the body, without actual stitch. So through catheter, so the catheter is a tube. So through catheter we do the procedures. So all the procedures related to heart, can be valve, can be coronary artery, anything from closing the hole, to opening the block, putting the new valve. So all these things are under interventional cardiology. So I'm trained specially in this from Amrita Institute of Sciences. So that is in Kochi, Kerala. Amazing institute. And especially what I learned, not just cardiology, what I've learned, but I have learned the holistic approach to a patient. So how can I be more like a mentor rather than just a doctor who prescribes? So I have learned that in Amrita. Amazing institute and amazing experience, and also Kerala, very beautiful state. So more of Ayurveda and more of yoga there. So in that way, I have had amazing experience. So coming to the point, structural, what exactly structural cardiologist means or interventional means. So the structure of the heart. Is there any problem? If there is any problem, we are going to correct it with intervention. So that is, if it is a valve or hole, whatever. So it's a structural intervention.
Okay. So, I didn't know what any of this meant before, angioplasty, and I was pretty surprised at the technology. I was just under a local anesthetic, and they just put the tube up, and I know this technology happened many years ago. It's developed. Now there's a new technology that you're specializing in, which is called TAVI, right? Can you explain a little bit about that? Because this is how it happens. All this new technology comes up, and it's amazing because you don't have to cut. You don't need an open heart surgery. It's just minimally invasive, and I was just floored being in there and how this is happening. So please tell us about that.
So TAVI is a very niche expertise of interventional cardiology, especially developed in recent years. So these exactly valve replacement, or you can call it implantation, and changing the native valve and putting an artificial valve where there is a stenosis of the native valve. So the valve is damaged. Blood is not going to the body from the heart. So there is no therapy for it. There is no pharmacotherapy for it. No medicines. So that's a mechanical problem. So we have to solve through mechanical. So we have to go, and previously the conventional way was open the chest, open the heart, cut the heart, take the valve out, damaged valve, and go inside and put the new valve. So conventionally, yes, from 1950s this has been happening. But recently, a few years back, the technology has evolved, and we have the new system, which the valve can be delivered to the heart through groin itself. So thanks to biomedical engineers and all the technology, they have designed in such a beautiful way that just in 1 hour the surgery is over, valve is replaced through groin, and patient walks in 12 hours and goes home in 48 hours.
Wow. And you do this in Jupiter, right?
Yeah.
How many do you do per week around?
So we do around 2 per month.
2 per month, okay. Okay, because it is a new procedure, people don't know about it yet.
Yes.
Okay, that's fantastic. Well, I wanted to address the kind of elephant in the room, because everybody's been asking me when I told them that my next podcast host is a cardiologist. So everyone wants to know why heart attacks are happening to fit people, and whether it is the vaccine, COVID vaccine, or whether they've got COVID. Does that have anything to do with it? What do you see in your practice? What is your experience?
Okay. So very relevant question, and in today's era. So after COVID 2021, so we all are very much aware what exactly is healthy heart mean, what is health, what exactly it is. We should take it very seriously, that now everyone is concerned about it. So heart attacks, yes. So as our lifestyle has changed a lot in last maybe 30-40 years, and so incidence of heart attack has increased a lot, spiked up. So the major cause of mortality for now is cardiovascular deaths. So all deaths in the world happening, the majority chunk is heart related.
This was even before COVID.
Before COVID also.
Yeah.
But after COVID, definitely in younger population it has increased. So now the concern is why young people. So because our lifestyle, especially what we say, the South Indian ancestry, what we have, that are genetics. So we are prone for such heart issues, that is by genetics. So now to keep it apart, we can't control genetics. So let's not discuss genetics. So because it's not in under our control.
Yes.
So yeah, so these are unmodifiable factors. So what are the modifiable factors? These are the risks which can cause such things, heart attacks. For example, diabetes, hypertension, like high BP, or cholesterol, high cholesterol, and maybe stress related to lifestyle or work, whatever. The stress is stress. So what exactly happens? The stress causes the inflammation in the body to increase. So inflammation will lead to the damage to the blood vessels, and that will cause blood clot, and that will cause heart attack.
Yeah, I want to bring one point that people are blaming COVID and the vaccine, etc., but they're not seeing how their lifestyles have changed in the last 20, 30 years. What we're eating, what the stress levels have gone up definitely. Whatever it is, we're looking for more money, or you're in traffic, or family problems. Stress levels have gone up. Our diet is really, it's not in a good place. We're the diabetes capital of the world. Hypertension is increased. So all of these factors, people are not, looking to.
Yeah.
They're looking at, of course, everyone wants to blame the COVID vaccine or getting COVID. It might have to do something with it because it wasn't researched very much.
Yeah.
But I think, we should concentrate on these things, right?
Yeah. So yes, COVID vaccine, as you asked me the question. So COVID vaccine has, every vaccine has some side effects. So mainly neurological. Most common are like itching, redness, fever. These are the very common side effects of any vaccine. So COVID vaccine is also, it's not something different. But definitely we should see that it has saved many people. But neurologically, if something had to happen, it would have happened in the window of 3 months to 6 months after the vaccine. So for now, I really want people to know that after so many years, maybe after 1 year, 2 years or 3 years, so this is not really COVID vaccine related. So the thing is, I really want to assure people that be relaxed. It's now many years have gone, so it's not about COVID vaccine now.
Okay, thank you. So the next question is, can you explain the difference between heart attack, cardiac arrest, and heart failure? Is it all the same, or?
They are interlinked, but they are different terms. So heart attack is when we have 3 blood vessels to our heart. So all the 3 blood vessels supply entire heart. So if one gets blocked 100%, that is known as major heart attack, and that leads to severe chest pain, and then we have to open it up. So that is angioplasty, and restore the blood flow. It can be done with medicines also, but not 100%. It may open it up. So by angioplasty, we definitely know we are opening up, we are seeing it.
Right.
So that is one. That is heart attack. So heart failure means failing heart is it's unable to fulfill the requirement of the body. So body needs blood. In the blood, what we get is oxygen. We get nutrients. So everything is in the blood. So heart gives blood to the entire body. So if heart is not giving adequate blood, it pumps 5 liters of blood per minute. So if it's not giving, it may be less than that. So that we call it heart failure. So less pumping.
Yeah.
So the weak heart, we can say.
Right.
That is heart failure. And cardiac arrest or heart arrest is something that heart stops beating. So the fatal rhythm, the fatal arrhythmia, so happens, that is VT or VF. The name, medical term, VT or VF. That means cardiac arrest. So heart attack may lead to cardiac arrest. Cardiac arrest causes are many. Heart attack is just one of the causes.
So the tests that we get for looking at our heart health are lipids, mostly lipids and triglycerides, which come into lipids. So there's a lot of on the net. Somebody came up on my feed. I think they're researching cholesterol. Some cardiologists in India was saying that cholesterol is good for you. It's needed in the body, which is true. It's there for a reason. And you should not worry about how high it is. And I have a cholesterol of 300 odd, and I think that's very misinformation, right?
Yeah.
So when should we get tested, and when should we go on? I know every individual is different, but depending on their other issues. But in general, what kind of numbers are good and bad?
So basically, the cholesterol issue, we are focusing on LDL and ApoB. So these are the lipoproteins which are inside the body. So as you rightly said, that we need cholesterol. because we need cholesterol to form bile acids for digestion. We need for hormones like steroids or sex hormones. Yes, we do need cholesterol to generate all these hormones, and also cholesterol is a major part of our cell membrane. So what we are seeing is we are looking at the cholesterol of a very particular type, that is low density cholesterol, that is LDL. So what it does, so it gets deposited in the blood vessels, that is known as atherosclerosis. So the major causative factor for atherosclerosis is LDL and ApoB. So this is proven in randomized control trials, which there are many. So like for example, PROVE-IT, CARE, Jupiter, all these trials, these are the names of the trials. So it's been proven that if we reduce this LDL, we reduce the rate of heart attacks. So we have the proof. And the best proof in the world is randomized control trials. It's not just observation, it's not just any person's opinion.
Right.
It's exactly the data.
Yeah.
So in today's world, we are driven by evidence. So our medicine is modern medicine, which is evidence-based. So if we have evidence, we will do that. If we don't have evidence, then we have to create and see what exactly is this.
Yeah.
And
Done
go
on
ahead.
humans. Right?
Yeah.
Yes. Research done on, not just in a lab.
Yeah.
Actually, yeah.
Yeah, the real individuals. But yes, and the cholesterol, usually in routine term we call it bad cholesterol.
Yeah.
So yes, so LDL does increase the risk of heart attack, and it's not always. For example, if I tell you there are 100 smokers, so only 10 smokers will get lung cancer. Does that mean smoking does not cause lung cancer? It's not like that.
Yeah.
So even if LDL 100 people have high cholesterol, so not all will get heart attack. It's not like that. So, but as we have seen, as the data I said, that more high LDL, the more chances of getting heart attack. So if we know, if we have family history, we have high cholesterol, and these are modifiable factors, we should make it in a normal range.
What about triglycerides?
So triglycerides are also not as bad as LDL,
Okay.
but yes, they do require some control. So the new trial, which is especially focusing on omega-3 fatty acids, very pure isolate of omega-3 fatty acid, that is eicosapentaethyl. So that has caused significant decrease in triglycerides. So very good to have omega-3. Usually many people have it in diet also.
Okay.
So that is now in the tablet form, and it does decrease the triglycerides.
So one way I remember that LDL is bad is the L. L is lousy.
Yeah.
L for lousy, lousy cholesterol.
Right.
So you said Indians are more prone to the heart attacks. Why do you think that is? Is it just the genetics, or is it the diet, or?
Yeah, mainly it is the genetics.
Genetics, right?
Yeah, few people are prone for maybe heart disease, few are for dementia, like
Yeah.
Alzheimer's, few are for some specific cancer.
Right. Thalassemia. There's all different, I guess, different ethnic groups have different ones.
So we do have that thing, because South Asian ancestry has this risk. It has been observed.
And we talked about stress, right? Can you talk a little bit about emotions, like, for example, any emotions like grief, guilt, sadness? Do you think that also plays a role in your health, and how do you recommend we control that? Or
Yeah. Emotions do play a role in heart health. So we cannot avoid any emotions because we are humans.
Yeah.
We are made up of this major 5 emotions like anger, happiness, sadness. Yes, we do. Our mind only knows what exactly is happening and how to deal with it. So we do know. But what we require is support of our family, support of our loved one, maybe a spouse or friends, and also from nature. So nature has self-healing powers. So it just, for example, if we go on a vacation, which city we choose? For example, we stay in Pune, we choose in Lonavala. Especially in monsoon, okay, we are going to see the greenery, to see waterfalls. So it makes us happy. all these things. So what does it mean? So nature has the healing properties, various ways, color combination, from sounds, from sight, everything. So one is nature. We can control the bad things with the help of nature, with loved ones, like having good relationships, family, friends. So definitely these all things will play a major role to control what we can say very bad emotional state of mind.
Yes. Yoga.
Definitely.
You must, because you're believe in the holistic approach that you learned in Kerala. So, that's what we're trying to do here, is continuously tell them about the healthful aspects of yoga, how you can benefit, etc., etc. So, what lifestyle changes do you recommend that Indians make in the city? We're in Gurgaon, okay? Let's talk about cities. What are the major lifestyle changes you would like to tell your patients or your to-be patients? Hopefully they're not your patients, they are healthy. Or you go to a office, or you give a talk somewhere. What is like the main three things you're going to tell them?
Okay, so that's it's a very important question you have asked. This is very important for everyone. So from age 15 onwards till elderly, it is applicable to all. So what exactly is happening in nowadays is people are stressed a lot because of so much of maybe competition. 10th grade person, a boy or a girl, wants to get into maybe IIT or maybe something else, or medicine. So they're competing a lot. They're taking stress. So recently, I heard the news. A 24-year-old doctor, a young doctor, committed suicide because he had stress that can I be successful doctor? So that's too early to say. And you don't have to be successful. You want to be a doctor, just be a doctor. You want to be a teacher, just be a teacher. You want to do sports, just play sports. Why? There is unnecessary stress. Maybe from parents' side, or maybe from the society itself, that I have to do this in a certain way, or I have to achieve this. So I think these expectations are killing the dreams and killing people. So that is creating stress itself. So number one thing, what I will tell, don't take stress. Just live a life, fulfilling life. And we really have so many things to be thankful for. In recent times, maybe 100 years back, there were no medicines at all. There was entire medicine field was just emerging. So now we have so many things to take care of.
Yeah.
So many things. If we get some issue, we can get treated. But the main thing is for prevention. We should not get at all any problem. And if we are prone, we have to control the risk. So get tested, have less stress of anything, or start dealing with the stress, because if stress is unavoidable, start dealing. So for example, yoga and meditation are very important tools to control the stress or to train our mind, just like we do our body, train our muscles in gym. We can train our mind to handle the stress and make it harmless, the stress. So stress is going to be there.
The brain is a muscle.
Yeah. So you are the better person to comment on that. How to do yoga, meditation, how to train mind. So you are the best person for that. That is the need of an hour to handle the stress. How to handle is to prepare our mind for that. And I think our younger generation, is not yet prepared for it. And it is facing this catastrophic things like depression, anxiety, stress to achieve something. So all these are mind-related things.
Yeah, and it's all interlinked. I mean, it all, like you said, causes the inflammation. It can create havoc anywhere in the body. Right? Yeah. So are you seeing? Go ahead. You finish your number 3, or finish one.
So as you said, the 3 things. The one is not to take stress.
Yes.
Yeah. So we are, as a philosophical or spiritual way, we are on this earth to have experience of this nature, of this world, of this beauty. So just enjoy it. Just be there, enjoy the moment, and that's all. And third thing, eat well.
Yes. What you put in your body really matters. So you mentioned youngsters. Like, what age should you worry about your heart? When should you get all these different tests?
Okay. So usually it is post 40, usually. But if there is a the family history of heart disease, a premature heart disease in parents or in brothers or sisters, definitely as early as 20, 25 is also we should just get it done, because few lipid problems are familiar, and that may lead to early atherosclerosis in the body.
Okay. So if somebody does have high cholesterol, you go on lipids, you would put them on lipids basically. But
On the medicines, so we have tablets, we have injections, we have so many new advances to control the cholesterol, especially for those who are at very high risk. So the statins is just one thing. So there are many more.
Okay. I wasn't aware of that. So it's good to have options.
Yeah.
All right. That's good to know. And I know that tobacco, smoking, of course, is a big factor in cancer and your heart and lung health. What about? I have two questions about. One is vaping. Does that affect it? And tobacco use. I know tobacco causes the oral cancers, but does it affect your heart?
Smoking, any kind of smoke, whether it's vape, whether it's hookah, or whether it's cigarette, anything, cigar. So the smoke, what we inhale, leads to the endothelial disruption of the lung. What exactly does it mean? So we have the lining of the blood vessel, small cells. These are endothelium. So basically the cover, it's like plaster of the wall in the room. So it's like the plaster of the blood vessel, endothelium. So because of the smoke, it gets disrupted. As it gets disrupted, the inflammation takes place there, and that leads to falsely high inflammation, even if it was not there, but because of smoke, and it starts having high inflammation at that site.
Okay.
And that leads to atherosclerosis, and then lead to heart attack or maybe stroke.
So vaping, guys, even vaping is bad. So people should know that. Everyone thinks it's a safer way. It's a safer way to do what?
Marketing style by vaping companies.
Yeah, it's a marketing style. Have a great flavor or vanilla flavor, but it's all the same thing. Unfortunately, it can cause havoc to your heart health. So getting back to what you eat, I know you said it's the third important thing you said. So what do you recommend people eat and not eat? Anything? When somebody comes to you, do you tell them anything about the diet, or you tell them to go to a nutritionist probably? But in general, what would you tell them?
Definitely now diet has become more concerning, because recently more adulteration is happening in the market, whether it's milk, whether anything. So much of adulteration is happening in every industry, in every material. So we really don't know from which source this packed food or maybe any food is coming. So firstly, we should really understand that what we are eating, is it really from proper source? Like nowadays organic farming and the farmer's certificate and everything is available. So if you really have to eat healthy, it's milk, dairy products or vegetables. So everything, the documentation for healthy food is available. So we really have to trust in our own city area where we can actually see that thing and eat those maybe we can say vegetables. So especially raw food is better because it's already in nature. You don't have to do anything extra to digest it. So the raw vegetables, green leafy vegetables, fruits, these all are very good.
Yeah. So whole foods.
Whole.
That are not processed.
Yeah, not processed.
Yeah. So try not to buy anything in a package.
Yeah.
Right. Yeah.
In India, so more of it is the fresh food.
Yes.
So we never had frozen things. We never had processed food before. So maybe that is the reason our body is not used to it. for the preservative. The food is used to it, but the preservative with food which is coming inside the body,
absolutely.
these are dangerous.
It's all new. Okay, we had biscuits, but we ate them. It was a few biscuits, but now you go to the grocery store, and you see aisles and aisles of different types of biscuits, masking that they're healthy. Okay, we already knew Parle-G was not healthy, but now we have oats biscuits and ragi biscuits saying that they're healthy, and you have large soda bottles. Used to get little ones, but now all of a sudden, people are drinking it, and people are eating these in bulk, and people are consuming bad foods day in and day out. It's easy, and Maggie is easy. So I think we have to go back to eating whole foods,
Right.
and we have such an abundance of vegetables and fruits, and we should definitely do that. So, how does sleep quality affect your heart?
Sleep quality, it's of course very important question. Sleep, few years back, American people used to say like 8 hours of sleep or 7 hours of sleep is good enough. Now it has changed. Now it's 6 hours. So we really don't know what exactly, how much is the duration is important. But what we know is we need sound sleep. So whether it's 5 hours, 7 hours, 8 hours, but sound sleep is very important, because sleep is rest to the body and the mind. Because the mind is the only thing which is very evolved in our humans. So we need to give it rest for the brain, for the body. So to live a good life, we need good sleep.
Yeah, if you don't get a good night's sleep, you're up the next morning.
Like a zombie.
Yeah, the whole day is kind of ruined.
Yeah.
You're tired, and it affects so many different things, your digestive system, and so I'm sure it affects all the systems.
And as you said about the sleep, I would also like to highlight on one factor, that is circadian rhythm. So circadian rhythm is the rhythm of the sleep. It's a biological clock. Once it gets dark, you feel like sleeping, and then early morning you feel like getting. So, but nowadays it has changed. So because we are sleeping late and getting up late, so that is not what we are looking for. Like for the sleep, sleep should be in a circadian rhythm sleep and a sound sleep. So circadian rhythm is very important to have good functioning and normal functioning of the body.
Sleep when you get up.
Yeah.
And get up and exercise. Let's talk about exercise. I know it's different for every age. Let's talk about 40 plus.
Okay.
What do you recommend for a 40-year-old, 45-year-old? If they want to do HIIT, high intensity training, is it okay? If they want to climb a single road a couple times, is it okay? Should they just walk? Should they just, what kind of exercise do you recommend for heart health? And usually people exercise, of course, for health reasons, but to burn calories. So, what's your take on that?
So exercise is must, because our body, we need to move it.
Yeah.
And how we can train our heart is by doing some exercise or by some cardio thing. So then we can do it. But how to do it, how much is to do, is very important. It's very individualistic. But what the Netflix series has come, I would like to tell you. You must have seen. So there is this Netflix series which focuses on the blue zones around the world, where majority people are living more than 100 years.
Mm-hmm.
So what they found, that what these people do exactly, so they live healthy life and above 100, majority. So the most common factor was they were always doing some form of exercise, aerobic kind of thing, uphill, going down, some movement. So they were not highly trained like athlete or gym persons. So they were moving.
Moving, gardening, right? Gardening and moving.
Yeah.
You just have to move your body all the time.
Yeah. So how you move, maybe it's our choice. But in a city, if we live, we have many options. We have treadmills. We have home routine, we have yoga, we have so many things. So we have to just move our body whatever we like. If somebody likes cycling, we should do. If someone likes swimming, swimming is the thing. If someone likes just routine jumping jacks, that's the thing.
So do something enjoyable that you stick to.
Yeah. Yeah. So some form of aerobic and some little strength training. The training like maybe 10 kgs.
Okay.
That's all. It's not like 150 deadlift. It's not.
Yeah. that more is not necessarily better. Right?
Yeah.
So okay, 55 plus.
55 plus, moderate intensity, I would say for any age group, especially more than 55, is best. High intensity, definitely it should be avoided. For example, I saw recently one patient who is 65 and he's into some marathons and he's having some competitions of some other high intensity workout like definitely we should avoid all these things, especially after 55. His body is not used to such stress for a long time. So we should, especially 55, we should have moderate intensity workout. It can be speed walk, it can be anything.
But if you're used to it, it's okay. Like if you've been a runner,
we should slightly make it less.
you should make it less. Okay.
Yeah.
You shouldn't be running that.
Yes, because
Yeah.
the exercise and heart health has U-shaped correlation. So the higher no exercise has high risk, and high exercise is also high risk.
I see.
So the higher intensity has again the high risk of developing cardiac issues.
Okay, I know two people. I didn't know them very well, but they're. I know of them. They were trekking, and one was in the Alps, and one was on sea road. This is not now. This is a few years ago. They had a heart attack, and passed away, and they were in their mid-50s. So I don't know. There must be many factors probably, but it does bring out the issue of when you get older, how much you should do, and. Yeah, that's good. That's good to know. So we can tone it down a little bit as we get older, but probably the time should be more. We should keep moving.
30 minutes per day minimum. Some aerobic form of activity is good enough.
Okay. Yeah, because I find a lot of women come to me for weight loss, and they're like, it's just my metabolism is low. I said it's not just metabolism. You're just not moving enough. Because when you hit a certain age, you might have more comfort, more health. You don't have kids, you don't have to run after the kids. You're more relaxed, you have more socialization, all these factors. So you just have to keep moving. And if we do have the comfort of health and everything, but we have to find ways to move. So that's important.
So a lot of people are surprised when women have heart attacks or cardiac arrest or issues. The fact is that heart issues or heart attacks are a much bigger killer than breast cancer or all the cancers put together. But that's a misconception. People are afraid of cancer, but they're not taking care. Women don't look at their heart. They think it's a men's disease. So do you find this in your practice? Like, do you have a lot of women coming to you?
Yeah, especially post-menopausal women. So they do have heart issues like equal to men. But the thing is, pre-menopausal time, the reproductive age group females, so they do have some cover of protection with their hormones. So because of those hormones, they don't get much heart issues. Till 45, till 50.
Yeah.
So they don't get much heart issues. But later on, as equal as men. But definitely why it is so important for a lady in the family to get healthy, because she keeps everyone healthy.
Yeah.
So if she is healthy and she is trying to be healthy, entire family will be healthy. So definitely we need more women to be health conscious, more of heart oriented, more of exercise oriented, more of diet oriented approach. So if our lady is getting everything done, like for example she is teaching children or maybe husband, so she is the one, she can keep everyone healthy in a proper shape and very nice way. So but the thing is, what exactly happens post menopause, the reproductive hormones are very less, almost no hormones of
You don't have estrogen to
Yeah,
protect
yeah.
you, yeah.
So the risk gets normalized as equal to man, and they may get atypical symptoms like some effort intolerance, or they don't get usually severe chest pain like men do. So what they feel like breathlessness. So
Is that
more of
effort
breathless.
intolerance means
Yeah,
that? Okay.
yeah. So effort intolerance means they used to do some work with ease. So now they are not able to do it with ease, and they may feel some breathlessness, some fatigue. So these are very atypical symptoms, not heart related exactly. So some breathlessness, some fatigue, not feeling fresh, something like this. So they should look for these symptoms and understand this may be heart related and get things checked. So whether it's really heart related or it's just a routine thing.
Okay. And what about pregnancy? Should they be? What should you look out for in those years?
So pregnancy routine screening should be done. That's ECG, 2D echo. These are very simple tests available everywhere in the world. So we should just get screened such pregnant ladies with this ECG and echo to look for, because young ladies. So to look for valve disease, because the change is really evident. The heart volume, the blood volume increases. So as you must have heard that in pregnancy anemia develops. Anemia is low hemoglobin. Actually the anemia doesn't occur. There is no blood loss. What happens, there is volume is increased in the blood, that leads to hemodilution. So the dilution. So more water, less hemoglobin. So that we think that it is less hemoglobin, it's not actually. So this is what happens. So the capacity of the heart is, for example, 5 liters. So it has to deal with 7 liters, 8 liters.
I see.
To provide to a fetus. So definitely changes are very evident and very dynamic in pregnancy. So we should definitely look for good hemoglobin. We should get 2D echo screened to look for valves, and that's
And generally, when you go to your gynecologist, she will do all these things, right?
Usually,
I mean,
yes,
usually,
they
okay.
do.
Okay, it's a routine.
Yeah.
This thing. Okay. So what about other conditions like hypertension, diabetes? It's more, you have more of a risk for heart disease as well, right?
Yeah.
So do you see that correlation or?
Yes.
Yes. Yeah.
Definitely, yeah. So these are the most what we can say top risk factors for any cardiovascular disease, whether it's heart, whether it's blood vessels, brain, like stroke. So hypertension, definitely, and as we call it with the age, essential hypertension. So essential means actually there is no cause as such, it's with the age. So hypertension should be controlled, because as such hypertension will not have any symptoms. Just very high BP will have some headache, some chest discomfort, but usually grade 1, grade 2 high BP will not have any symptoms. But we should get regularly checked, and we should keep it in a normal range, so that with the high pressure organs should not get affected.
Okay.
Because BP will not cause any problem as such, but it will damage brain, heart, kidneys. So routine control is very important.
So, but usually you would go on some hypertension medication.
Usually we do,
Yeah.
but if there is some reversible factor like obesity, lack of exercise, or some very much stress, so then we try to do it with that. If it's not happening, then only we start medicines. So basically first is prevention and do the reversible thing if things are happening. For example, recently I had a patient who is IT professional, a software engineer. They have to travel to their company, and what he told me, he was driving 90 minutes per day in heavy traffic. And I asked him, you please try stop driving, get a driver or get a cab and see what is your BP. It actually came down. He stopped driving and BP was normal. So
Yeah.
these are the factors reversible. These are the lifestyle related issues we are facing. So not always medicines, but we have to deep dive into such things. What exactly is happening with that individual, and we
Right.
can try focus on that.
Okay. Talking about medicines, so when you do go on a statin, is it a time thing, both hypertension medication as well as statins. Once you're on it, is it very difficult to get off? I mean, if you need it, you need it. But I'm just asking because many people are like weary of, they don't want to take the medicine or they don't want to be on it for lifelong. But we are lucky that these are available, that save us. But what is your message to those people?
Okay, so statin is it's standalone thing, but what I prescribe is statin with lifestyle. So statin will not do its own work as such, but it has to be along with the lifestyle changes, then only it will be helpful. So the drugs we are giving is just I would say temporary basis and just to control a very dynamic problem, but we have to understand the lifestyle change, what we are going to do, maybe exercise, diet, meditation, yoga, all these things are going to be very helpful to bring down cholesterol in a good way, and till then to support a person statin will be helpful.
Okay.
But if a person or a lady falls into very severe risk of recurrent heart disease, then we have the score, ASCVD risk score. So with that score, if she is fitting into very high risk category, we should continue it for a long term.
Okay. So no harm in taking it long. Have there been any studies for long-term use of statins?
Yeah. So statins, there are many studies for statins, long-term use also. The side effects are very infrequent. They are very less. Usual side effects are muscle pain and maybe muscle injury sometimes. They are very rare. So we do understand if someone is having such symptoms like pain in hands or legs. So these are muscle problems. So we should definitely look for the blood test and come down on the dose. Okay. But nowadays the good news is, other than statins, we have moved now towards non-statin therapy.
Oh.
So that is, there are new
Yes, you mentioning that. Can you elaborate on that a little bit?
Yeah. So we have new groups of medicines. Those are oral forms. Those are subcutaneous injection form. Those are IV forms. So all these are now available to control the cholesterol for especially the acute phase when someone is having heart attack and very very high LDL. So we do have, other than statins, we have many other drugs also which are very safe.
Okay.
So statin is a safer drug, definitely. But if someone is having muscle problems with the statin, then we can switch to other drugs also.
Okay. So is it possible, like you said, for the acute problem, to bring down that LDL and then do the lifestyle change?
Yeah.
That's something that can be done?
Yeah.
Okay.
And we are doing it routinely. Yeah. We are doing it.
Oh,
yeah.
Okay.
Especially for younger population.
Right.
Where LDL or some triglycerides, they are very high and family history is very strong. Premature atherosclerosis is happening. So with the injections, we are controlling the LDL in acute phase, and we are trying to maintain it with the lifestyle
fantastic.
change.
Yeah. And that way they get that shock of that, okay, I have high cholesterol, and they are able to bring it down, and then they're given a protocol naturally, and which will be helpful in all aspects of their life, not just heart health, but the overall health. Whatever it is, the diet, the exercise, mind control. So that's wonderful. That's good to know. And now we're talking about younger people. I know that we are seeing younger and younger people with heart issues. And you mentioned that in Jupiter, there's a new clinic that you've started. Can you explain that a little bit?
Yeah. So the young deaths, we all can see. Nowadays, many deaths are happening in gyms, while trekking, or maybe in clubs. So young people, they are dying suddenly. So what we understood, not all these cardiac arrests are heart attacks. Few are heart attacks, but there are other things which are what I can say is undiagnosed heart conditions. So these are, for example, cardiomyopathies. So cardiomyopathies are the disease of a muscle of the heart. So it may get thick, it may get thin, it may get ballooned up, or it may get just stiffer. It is variations in the cardiomyopathy, many variations. So usually undiagnosed. So they may suddenly collapse. because of rhythm problems, cardiac arrests. So I have seen many cases like this. They don't have heart attacks, they don't have blocks, but they have cardiomyopathies. So
Okay.
very simple tool, 2D echo, ECG is very simple tools. We just can screen them, anyone, any healthy person, or especially those who are having family history of sudden cardiac death of related to blood, the blood relatives. So if they have it, one should get screened.
Okay.
And with the clinic, we have started cardiomyopathy clinic. The aim is to prevent cardiac deaths in young.
Okay.
That is our aim, because in India we are the nation of young people. So if we are saving young people, then we are saving India basically.
Yes, absolutely. That's a good way to put it. Yeah.
So
We need a healthy young India.
yeah, healthy young India. So we are screening them. We are performing genetic testing if needed. We are performing advanced imaging like cardiac MRIs, and we have expertise under one roof. We are together as radiology, cardiology, genetics, and cardiac surgery. Together we are performing to give the best possible service to our patients. So we have started this clinic only to save our young generation.
Wow, that's good to know. So, okay, if you have a history, I know you should go and get checked. But in general, I know like a lot of there's these tests you get, these, and you go to a hospital and you get a bunch of tests done, blood tests, and are the echo, 2D echo, and everything included in that?
So usually in for example, Jupiter Hospital or any multi-speciality hospital, they are included.
Okay.
The imaging is X-ray, 2D echo, USG scan of the abdomen. Usually they are included, but not always.
Okay.
So only lab tests, only blood tests are not enough.
Yes.
So if you really have to get checkup done, entire body thing, so not blood test alone will not suffice. So we have to go for ECG, 2D echo, treadmill test, stress test, and maybe sonography. So these are the routine packages. We should get just thing done, understand that okay, I'm not having anything, and be relaxed.
Okay, so guys, remember that. Make sure your health package includes these tests, and if you do have any type of family history, address it, and make sure you're getting the right tests. So so I think that wraps up our conversation. What is the last message you'd like to tell everybody?
So my message as a cardiologist and as a mentor, what I always tell my patients, so I'm not just a doctor. I am here as a mentor, try to help them if they need on any advice. Usually one of my doctor friends, he has spoken in a very good way in one of the interviews that doctors, we don't make money by dealing with sick patients. We make money by giving good advice. So consult your doctor and take a good advice, understand, get individual advice properly, and sort things out. That's all.
Well, thank you very much, Dr. Tanmay Kulkarni. So where can people find you?
So I am at Jupiter Hospital, and my OPD from Monday to Saturday, morning and evening.
Long hours, but we have a wonderful infrastructure here, right here in Pune, and we're lucky to have that. And I want to thank you for your time and for all the relevant information you gave today.
Thanks a lot, Rita.